the wound management part 1, and that will be about the bed sore. Okay, so we know that how important it is for us to recognize the patients who are at the risk to develop bed sore, right? So, how can you define it? So it is a kind of injury to the skin of patient and also the tissues lying beneath skin, and generally it is caused by pressure, okay, which will uh, be unrelieved, or you can say the constant pressure will be there on one place, and it is capable of doing the problems in the local area. And why it is so important for us in palliative care? Because you know that the prime importance and the prime aim of the palliative care is to provide comfort to the patient. Okay, and when any injury is there in the patient, he will be uncomfortable. Okay, so you can imagine a small sore on our body, how uncomfortable we become. Okay, and what are our patients? They will be, many of them would be bedbound due to different reasons. So we can imagine that how uncomfortable it would become for them to have an injury on the body. Okay, and most of our patients, they are very fragile, and the condition, overall condition of the patient is such that they are very much prone to develop this bed sore. And that is why it is very, very important for us to know why they occur. And first of all, prevention is better than cure, right? So how to prevent it, and if at all it happens, then what to do about it. Okay, that's what we are going to discuss today. So all of you know the causes, right? Mainly there are three causes. Okay, first being pressure, just now we saw in the last slide. It is said that it takes only 6 hours to start for the pressure sore. Okay, but takes very long time, you all know. And generally, whenever there is any pressure sore developed in the patient, always nurses are blamed for it, right? Okay, so that's why first of all we should prevent it. So that should be our utmost aim. Uh, it is also said that if the pressure at one particular place is more than 70 mm of Hg for more than 2 hours. So you can imagine the patient is lying on the same condition and fragile condition of his body, and over the bony prominences he is lying. Okay, so so much of pressure is there. So if we don't change the position, then what will happen? There will be destruction of the tissues in the local area, and it will lead to pressure sore. All right. Second most important cause is the friction. So many a times it is seen that there will be abrasion of the stratum corneum, that is the layer of the skin. Okay, and when the skin gets rubbed against any type of clothing or any kind of equipment that are used for the nursing care of the patient, and even bearing, right? Whenever there is such friction, patient is liable to get the bed sore. And last but not the least is shear force. Okay, here what happens is forces are parallel to each other but opposite in direction. Okay, so imagine that you are pulling the bed sheet against patient's body, or you are trying to put on clothes for him. Okay, or you are taking away the bedpan, right? So here what is happening is that forces are parallel to skin, right? But they are in opposite direction. So three major causes. So now we should know that, okay, these pressure, friction, many others are there. right? Like the patient, we will see in the subsequent slides, like moisture and all. Okay, so, but these are the prime causes. Okay, so let us move to the risk factors. Which of our patients of whom we are taking care, that they are at the verge of developing pressure sore. Okay, so you can say that the person is having sensory perception impairment, right? When the person is not knowing what is happening, he has no sensation, then he is bound to develop bed sore because he won't come to know what is happening to his skin, right, in the local area. So that injury will take place. Patient is not mobile, right? He himself is not able to move in the bed, right? So he is bound to develop pressure sore. What about if the patient is unconscious, right? So there also you will find that patient develops sore very easily. Here comes the moisture, right? Patient is having fecal and urinary incontinence. So all the time, patient's skin is very wet, right? Very moist. So because of that, the tissues will become very loose and they are bound to get injured. Then altered mental status, including delirium and dementia. Right. So patient is not able to find out what is happening to him, not able to judge what to do. Right. So always he is in the state of confusion. Right decisions he is not able to take. Right. So there the person is bound to develop, and he basically doesn't know what is happening with his body. Malnutrition. What happens whenever there is any kind of injury? For tissue to remain healthy, it requires good nutrition, right? And if the patient is not getting enough nutrition, then cells will not get enough adequate nutrition. And because of that, what will happen? Death of the tissues will take place, right? And it will cause bed sore. Dehydration. Here, because of excessive dehydration, what happens? All the moisture is gone, right? And we know that the our cells require moist atmosphere, right? Liquid atmosphere to live in. Otherwise, they will die, right? So because of that, the patient will develop bed sore. What if there is excess of fluid? Okay, there also a problem, and patient is having edema. Then also there is collection of fluid at the local area, right? And there will be you can say damage to capillaries. They will get ruptured, and then the death of the tissues will take place. Similarly, anemic patients will also uh, lead into problem. Hypoxia, lack of oxygen, right? So the tissues are not getting enough oxygen, so they are bound to get necrosed. Hypotension, again, what will happen? The small capillaries, they are not capable of supplying enough blood circulation to the local area, right? Because adequate pressure is not there. Okay, and tissues will be deprived of a good blood supply. So again, leading to bed sore. Excessive body heat, for example, in the case of a patient is having very high fever for long period of time, again dryness of the tissues, okay, and it will cause excessive perspiration also, right? So always moisture will remain there and patient can develop bed sore. Advanced age, we all know, we all have elderly in our each one of our homes, right? So they again become very fragile, bone and skin, right? And because of that, they are at high risk population to develop bed sore. And of course, all the secondary conditions like diabetes, cardiovascular diseases, where what happens is that the areas, or you can say the tissues, blood vessels are a problem, and because of that there are high possibilities of developing uh, bed sore. right? So these are just some of the risk factors, not all, but most of our patients who are in palliative care, they are having these problems. Okay, so that's why it is very, very important that we take good care of them, identify the people, okay, who are at risk. Okay, so now let us move to the pathophysiology. Okay, so the first uh, being the cause that we have just looked at the various risk factors. Okay, so these risk factors would be acting on the areas of soft tissues, which are particularly lying above bony prominences. Okay, where uh, the tissue layers will be very less. Okay, and because of that, what will happen? The capillaries will are bound to get damaged. So at these regions, the pressure will exceed the normal capillary pressure. And because of that, what will happen? The capillaries will get occluded or they can tear off. Okay, and what will happen? The local tissues will not get adequate blood circulation. And because of that, there will be necrosis of the tissue. So that is what we call as the pressure sore. Okay, let us quickly go through the stages. Yes, so first stage is known as stage of erythema. So the name itself suggests that the tissues will look red in color, right? So discoloration of skin is found in the region. You can see in the picture also. Okay, and here what will happen that there will be non-blanchable erythema will be there. Okay, means what? When you press the area, it will not blanch or it will not change the color. Okay, generally what happens when we press the tissues, it will become for time being because it will be deprived of the circulation. So it will turn into white. But as soon as we take off the pressure, it will regain its pink color. Right? That will not happen here. Plus, you will find this area little warm compared to the surrounding area. And patient may complain of you about the pain in the area. There can be edema also. So immediately you should pay attention and remove the pressure wherever this is happening. Okay. And in this, only the upper layer, that is epidermis, will be injured. Stage 2 is known as partial thickness, or many times you find blister also, right? So as you see here, there is loss of dermis, okay, and you can see that there is shallow open ulcer. Okay, skin has come off, right? Uh, Epidermis has come off, and you can see the underlying area. Okay, and what has happened? Blister might have taken place. Sometimes blister may have opened up, okay, because of the rupture. So you will find abrasion in the region, and it will be, of course, very painful to the patient. Third stage is full thickness skin loss. Okay, here you can see fat also. Okay, and because now the subcutaneous fat is visible, and in this particular layer of skin, less blood circulation is there. Okay, and because of that, many times it becomes very difficult for the ulcer to get healed. Okay, and you can see the surrounding tissues also. They are also at different level of the bed sore. Last stage is of the full thickness tissue loss. Okay, it is the deepest and even extends into the muscle, tendon, or even bone can be seen through the wound. Okay? So supporting tissue loss has occurred. So you can imagine that how difficult it would be. for it to get healed. And plus the time and the amount of pain and uncomfortable feeling will depend how big the wound is. Okay, so that is why always we should measure the wound, okay, and if possible document it by taking photograph of it so that we know that whether it has the condition of the patient has improved or not. There is even unstageable stage also. Here what is there? Because it is the wound is covered with HR, okay, and because of the dead tissues, and there can be pus formation also, secondary infection also. So depth is not known. Okay, we directly cannot find what is the depth of the wound. Okay, before we clean it nicely, all the HR is removed, we are not able to identify the stage. That is why it is named as unstageable. Many times it may require even surgical repair also. But what would be the outcome, or you can say the prognosis, will depend on many other factors. What can be the complications? So the surrounding tissues, there can be soft tissues which will get inflamed. Okay, then bone and joint infection can also take place. Now the blood circulation and is not there, so more and more necrosis will occur. Okay, the infection, because you know that the skin is the protective layer, right? It prevents infection going in the body, right? But now as it is lost, what will happen? Infection will directly enter into body, and through the blood circulation, even sepsis can also take place. Okay, so what would be our aim? Okay, first and foremost, we have to identify the stage, okay, and uh, act accordingly, right? So first, our aim will be relieving of the pressure and prevention of further complications. So how will shall we take care of skin and the pressure points? So let us see it every point into detail. First is general hygiene. How to go about it, we will see. Changing of the position. We know that every 2 hourly is must. Okay. About the bed linen, we have to provide it free of any wrinkle and food crumbs. Then avoid any kind of friction, maybe the shear friction or the just minor friction, and regular inspection of the pressure points. So how to go about it, we'll see. So in hygienic care, the skin should remain supple. Okay, now how to keep it supple? It should be just enough moist, not too much of moisture, right? And should not become dry also. So in palliative care, we don't use any kind of talcum powder. Instead, what we do is after giving good bath and after drying the skin by petting, not rubbing harshly with the towel. Okay, just pet dry the skin and then immediately apply any moisturizer. Okay, anything that is available in patient's home, not to go for any fancy materials, like at least patient will have good hair oil in his house, right? So coconut oil without any fragrance, of course, can be applied. Any edible oil can also be applied. Okay, so just take enough amount as the skin is still slightly wet because of the water. Now your moisturizer will be able to spread very evenly and nicely. You will wonder that what to do in this summer. Okay, so here also you will apply coconut oil, but of course the amount will be different. Okay, comparing the amount which we need to apply during cold season, right? So you can understand that it will be small amount. Okay, so that's how it should be done. Even small amount of petroleum jelly can also be used, Vaseline can be used. Okay, and of course it will depend on the condition, economic condition of the patient. That's why I told that any edible oil, okay, and coconut oil will be of course available with the patient, so that can be used to moisturize the skin. Okay, so that is the first very important point. What else? Patient should be lifted, shifted very carefully when we are particularly doing bedding. Okay, always teach the patient's relatives how to go about it, not to pull the sheets or not to pull the clothes. Okay, changing of the clothes and all these things also matter a lot. Other things like physiotherapy, recreation therapy, diversion therapy, all these things are also very important. They will also take care of patient's mental condition, right? So, and patient is bound to move and will always remain happy. So these things are also very important. And plus the exercises will help in developing good circulation of the blood in the tissues, right? So that will help in healing also and as well as prevention. So, right. Now changing of the position. So you can see here patient lying in supine position where all he can get the bed sore. Okay, so the places are already shown here, right? And you might have seen the bed sores at these places. Now imagine the patient is on sideline position. So ear will also get affected. Okay, so you have to be quite uh, watchful at this region also. Many times it goes unnoticed, okay, but that should not happen. Then when the patient is in prone position, so here are the points where we have to look after, right? So every 2 hourly change in the position when the patient is in the bed. Okay, that is very important. Then what about at night? So once in a night is enough. Okay, many times you may be going to see the patient uh, to give some water, right? So at that time, you can just change the side of the patient and make him comfortable. What if the patient is wheelchair bound or patient is always like to sit in the chair and watch TV shows? Okay, so here what happens that the shoulder blade, sacral region, the back of the knee joint, food, right? So these are the points where the patient can develop pressure sore very easily. And even lot of perspiration also, right? And that can lead to development of the pressure sore, right? So when the patient is in this position, every 15 minutes you have to change the position. Now you will wonder that how to do that. So you can ask the patient to move a bit, okay? Or you can place a small pad under his knees, okay? Under his thighs, okay? Under his shoulder blade, right? So that is how it will be prevented. Gentle massage is good for uh, good blood circulation. Okay, but too much of pressure is not good because it will damage tissues. Okay, so pressure points, there too much of pressure should be avoided. And when there is pressure sore, it should not be massaged over the area. Then about the joints. So what to do about joints? So you have to tell the patient when he is able to do it himself, or you have to do it, give him passive exercise, right? So each joint twice in a day, 10 times. Okay, so say for example, your elbow joint, then 10 times morning, 10 times evening. Similarly, all the joints should be moved. Okay. Why so? It will also help in prevention of atrophy of muscles. Okay, and plus joints are bound to get contracture, so that also will be prevented. Okay, and of course there are chances of development of deep vein thrombosis. Okay, so when you move the patients, what happens? Good circulation takes place. The veins will drain into large, superficial veins will drain into large veins, and the blood will be emptied into heart. Okay, so it is always good to do stretching of all the joints. Positioning of pillows. Pillows may be available plenty in hospital, but it may be scarce in homes, right? So many times patients are very poor. So what to do? So at that time you can use any soft cloth. Just make padding of it, okay, and place it between the joints, especially when the patient is lying on his sides, say for example, just below the ankle joint or between two knees, right? That is very important. All that what we want is lift up the pressure from the joints. These equipments are very much now in demand, and many of the NGOs are also there who provide, and many places with nominal charges also they are available on rent, right? But they are not the final solution. You should always instruct carers, and we as nurses also, we have to remember that these things are good to use when available, but they are not the ultimate solution, right? All the other things, for all the other preventive measures should be continued, okay, though the patient is given air bed and water bed. Okay, what other care should be given? So, uh, most of when the patient develops pressure sore, uh, they do heal, okay, but it will depend on many factors, like what is the general health of the patient, what diet patient is getting, okay, how much pressure is relieved from the sore, okay, whether it is dressing is done regularly or not. These things will be greatly uh, demanding also. So how to clean the wound? So at home, we can use normal saline. Of course, in the hospital also, it is best to irrigate the wound with the help of normal saline, and not to use hydrogen peroxide or betadine for cleaning, because they do more harm than good. Okay, and what happens is that granulation tissues also get rubbed off when we are trying to uh, clean it, do vigorous cleaning. Okay, and these solutions, they will harm the such newly grown tissues and can hamper the healing of bed sore. Any dead tissues, any necrosed tissues, any scabs should be removed. How to go about it? So moist dressing is the best technique, because it will prevent uh, pain also, okay, and all the slough will come off when you wet the dressing. Okay, so you have to ask the patient to get good bath before dressing, so that he can we can take off the dressing, old dressing, because it has become moist very well, okay, and without damaging any granulation tissue, we can do cleaning also. Okay, so moist dressing is good. Pain relief from dressing is also important, because whenever we go to patient, you might be seeing that they are in too much of pain, and they will remember that, okay, now again I have to undergo the same process and I am going to have now pain. Okay, so that thought of it itself will provoke more pain. Okay, so what we have to plan is that plan your dressing times after the dose of analgesic. Okay, suppose patient is getting analgesic at 10, then you plan your dressing at 10:30. Or if not possible, then we can give extra dose of the painkiller drugs just before the 30 minutes of dressing. Okay, so that's how you can prevent pain occurring during the dressing times. What about nutrition? So healthy diet is very important, right? Our patient may be getting restrictive feeding also. So what healthy diet should be given, that we should know, and always use local resources. Okay, don't give them fancy diet menu. Okay, because many times they wonder that how to go about it. Many times it happens that patient will get same items every time, yeah, and patient will get fed up of it, yeah, and patient will not eat or will refuse, right? So what to do? Use local resources whatever is available, okay, and uh, not to instruct him or the carer that okay, take good protein. But what is there? What are the sources of protein that should be included in your health talk? Okay, so big headings should not be used. Take vitamin C, but patient is not knowing, carer is not knowing with what is vitamin C. Okay, so that should not happen. So extra protein, that is always good because new tissue generation will regeneration will depend on protein. Vitamin C also because it will boost immunity. Okay, and with other things like zinc, vitamin B12, B complex, all these things help in good healing. Even vitamin E is also good for the healing and skin integrity. Okay, so that is very, very important. And maintaining skin integrity with the adequate fluid intake. Okay, so minimum of 2 liters of fluid, of course, when the patient is having any heart condition and when there is restriction over fluid intake, you have to be watchful. Life changes, again, very, very important. Many of our patients are smokers since very long time, alcoholic also. Okay, so these things they have to change because they do create problems with the regular healing process. Then comes exercise. So daily exercise, how it improves circulation, we just saw. Okay, fine. Other things like control of incontinence is also important, right? Using appropriate measures. If the patient is capable enough, you can use diapers, or if not, then any clothes which can be turned into pads and that can be placed. Okay, so that will also serve the purpose. So measures should be taken, and he should be kept dry as far as possible, right? Because too much of moisture is the leading cause of development of the bed sore we just saw. And also it will attract lot of other, moisture will always attract lot of microorganisms. So secondary infection will easily take place. Uh, if required, then oral antibiotics can also be prescribed. And in that case, then we are responsible in giving the treatment at regular intervals. And if the patient is at home, we need to find out whether he is taking it or not. And of course, when we go for home visits, we should always watch the, we should take audit of whatever tablets he is taking. Education of caregiver is, that's why, very, very important. Surgical repair, whenever possible, is done, especially in the third and fourth stage of bed sore. It might be done. Of course, it will depend how big the wound is. Okay, so different procedures are used, like tissue flap can be done, or plastic surgery may be done. Okay, and there, as nurses, we have to give pre and post operative care. Other treatment options that are available in the hospital are hyperbaric oxygen. So here the tissues are given high pressured oxygen. Either patient is kept in the oxygen tent, or the injured tissues are kept under oxygen. Okay, then topical use of growth hormones, growth factors is also quite useful for good cell metabolism during healing process. And negative pressure wound therapy is also used if these tissues are exudating large amount. When there are more HR at the place, this is another method of using the vinegar. So here 1 ml of vinegar is mixed with 9 ml of normal saline. Okay, and you have to dip the gauze piece in the solution, then squeeze it and place it over the HR tissues. Okay, so what it will do, it will the HR will be removed slowly, and we can come to know what is the stage of the bed sore. Uh, Many places, if the wound is smelly, right, then what you can do is use of Metrogyl tablet powder. Okay, so you can instruct the caretakers to keep the powdered tablets into airtight container and use it, sprinkle it over the uh, wound. So that is also antibiotic, so that also will be helped. Infection will also get removed. Use of papaya leaves is also done. Raw papaya is also used, and aloe vera pulp is also used. So here, when the wound is even, okay, surface is even, so you can place it, uh, the paste over the uh, dressing material, and then keep it over the uh, wound. Okay, and uh, otherwise, you have to crush it and make the pulp of it. Then that will also help. It is also good healer. So as a nurse, what to do in prevention and management? Let us summarize one by one. So we have to first do assessment, right? Assessment is very, very important, because then only we can identify who are at the risk. And if we are treating, then we know what is the result of our treatment. Okay, so condition of the skin, at least twice in a day, you have to watch very carefully, right? Any predisposing factors, risk factors, you have to remove. uh, Pressure site especially you have to remove. Find out patient is lying on the same side. Sometimes it may happen that a patient is comfortable in one particular position. Okay, then he will not obey you, right? So we have to be very careful in them. Palpate the skin and see whether there is increased moisture or increased temperature is there, right? How is the condition, dryness is there or not? How much mobile patient is? What is his circulatory status? Whether he is having any comorbidities or not? What is his neurovascular status, right? All these things should be that will need careful assessment. Any incontinence, right? What is his nutrition, regular diet he's getting or not? You can collect the history of past 24 hours, right? What he has taken whenever you meet the patient or carer. And of course, we have to note these problems, okay? And not to forget about the pain assessment. So this is Braden scale. You can find out uh, who are at risk, right? So all the 5 factors you can see here: sensory perception, moisture, activity level, mobility level, nutrition, and friction, right? So whatever is applicable to your patient, you have to do tick mark, okay, and then do the total of it and find out your total score. So here the assessment levels are already given, whether patient is in the high risk or severe risk or moderate or mild risk. We can find out. Then when there is decreased sensory perception, at that time we have to see the points, right? Assess the points where there is more pressure, okay, and see to it that the pressure is distributed, patient weight is distributed equally, right? So whatever measures are should be taken can be uh, found out. When the patient is incontinent, so at that time adequate uh, padding should be done, right? And we just saw other things like use of diapers and all can be done. And of course, the moisture should be seen, level of moisture at the local region. Avoiding friction and shear pressure, we saw that not to drag the patient in the bed. Many a times we do know, when patient is in Fowler's position and patient has moved towards the foot end, we just pull him upwards by merely holding his clothes, right? So you can imagine that it will be very painful, right? So such thing should not be done. Instead, you can use lifting sheets, right? So lifting sheets, you can lift uh, 2-3 persons and then move the patient upward. Use of comfort devices should also be done. Less amount of activity or less mobile. So there should be a schedule when to do, so no one forgets. Okay, so whatever comes in your shift, you have to be uh, careful and do it. Poor nutrition, what he is getting, uh, including fluids, should be noted. Careful intake and output chart should be maintained, right? And all these things should be documented. That is very, very essential. And as I told you that it can be photographed also, right? So you have to take the permission of the patient and carer whether to photograph or not, and see to it that his identity is not revealed when you are taking photograph, right? So that will suffice the problem. So with this, I would like to end my presentation here. And if you have found any difficulties, then we can discuss first, then we will move towards the uh, presentation.
Thank you, Anna, for the presentation.
Hi, sister. How are you?
Hi. Fine, fine. Happy to see you again.
No, thank you. Same here.
Okay. So, anybody have any doubts on this? Please ask. So we all are nurses. We all familiar with wound management. I'm sure you have a lot of doubts on this. Please ask if you need any clarification or any suggestions. If you want to add that thought, also you can. Renuka ma'am.
Yes, sister, can you tell me about that papaya and the leaves of papaya? That's is there any risk for an infection or something when we are applying all these things?
Risk
Actually, we are
means
not using because
yeah.
of fear about the infection risk.
Yes. So what you have to do is that clean it nicely. Then you can create pulp of it and then use. Right. So you can even dip it in salty water like that for some time. So all the organisms and all that will be killed, and then you can apply. That also can help, I feel. In many rural areas, interior areas, they use these things and it is found quite useful. So I personally don't have any experience of this, but yes, I have heard about the aloe vera gel. So there also you have to remove the skin and inside will be like sterile only, right? So that you can apply on the gauze piece and then apply over the bed soap. So that helps.
Can we keep that in as a dressing? Can we keep?
Yes, yes. Even
Actually, I have
honey,
some experience about that. We didn't do, but we saw that someone has
right.
put a dressing papaya,
Yes,
the raw
papaya,
papaya. They
raw
have put some
papaya.
raw papaya, but it was more than 2 3 days later. We removed all these dressing packs. It was
Hmm.
like a green stuff, like a pseudomonas or something like that. We were scared
Okay,
about that things.
right. So it should be cleaned every day. That
Yes.
is one thing. Otherwise, it will have other problems also.
Okay,
And
thank you,
many
sister.
times,
Thank you.
I mean, in at home, no, sometimes what happens, ants will also get attracted to food material. So that also should be looked into because patients keep on eating everything is in the bed, right? So many times patients are found with ants, lot of ants on their beds. So other things will be there. Even
Other
honey is also good. Honey
yes,
can
honey,
be
bee
applied.
honey. That
Yeah.
in UK they are using honey.
Yes, honey is also good, and because of all its antimicrobial uh, characteristics, no, it is quite useful.
And other than that, sister, that applying the oxygen therapies, that normally we are giving some oxygen to, we are supplying some oxygen to the around the wound about 10
Yes.
minutes time like that. Normally,
Ye-
we have experience that is very effective things.
Yes, that's
Yes.
good. That's
Stage
good.
1 and 2 is very effective. I have
Yes,
good experience about that. Okay, thank
that's
you.
good. Thank you.
So how did you do that?
Sorry.
And how did you do that, the oxygen therapy?
Just take in the oxygen tube when we are giving the oxygen things tubes, no administration tubes, and just about 2 3 inches like that. We are keep it like this surrounding area. Just give it around
Cannula.
10 minutes like.
Okay, thank you, thank you.
Hello, ma'am. And how many hours we have to keep that dressing, papaya dressing?
That will be like regular, no, twice in a day you can do, so that like that, and it will of course depend on how much exudate is coming, right? If more exudate, then twice in a day or once in a day. Same like what we do in regular dressing.
Okay, thank you, ma'am.
Any other questions?
Hi, sister.
Hi.
Bo here from Malaysia here. Yeah, I
Hello.
can hear me.
Yes, yes.
Yeah, because I actually just finished visiting a patient, right? This patient is a very big size, and she initially is just a very small abrasion wound at the groin at the thigh there lah. But I think the family members didn't really know how to do about the nursing care. So the wound is actually getting more, it's like multiple abrasion wound like that at the patient's thigh and also the groin and also the abdominal layer because it's like very fat and like the layer overlapping like that. So I just now tried to do the dressing for the patient, but I found out that actually it's very wet due to the patient sweating and the heaty, all that lah. So I just want to ask how you all will do with this condition, because even we want to cover with the plaster, right? It's very difficult because a lot of multiple small wound surrounding around near to the groin and even very near to the vagina. So it's very hard to put the plaster. And when I suggest the family members to insert the urine catheter, but they're very reluctant about it because they're scared of urine infection. So in this kind of condition, what you all will suggest? Hello?
Yes, so if the patient, you can convince a patient to have catheter, right?
Mm.
But otherwise, what to do is maybe the area should remain dry, and if small I mean, sometimes it may happen that small wound is there, but there are multiple wounds, right? So in such case, what you can do, that cover it with the large dressing at one place rather than doing separate things. So that will decrease the chances, I mean, of applying plaster at various places, because applying plaster at various places will again harm the skin because of its
Understand.
gum. Many times the person can be allergic to gum of the plaster also, right?
Okay, but
So
how about the area that like near to the groin and also the vagina area? If we cover, if let's say I cover with the big gauze or gumji pad, right? How should I
huh,
plaster it? Because it's very
yeah,
near there and cannot. I can't. If I don't know how to put the plaster, then they are so reluctant for the catheter.
right. So it, you can hold the gamgee in place with the help of say you can what to say, the what we use for like elastic, either no at the, or tie with we tie sanitary pad, no, like that
Ma'am,
Oh,
it can be
actually,
done.
we are using the cetonate or something like that. As a burn patient, we are using the cetonets. You know that nets like something, the cotton pieces. We had a radiotherapy patient like that, had a vagina all around the buttocks and things. We covered by, we are using that. We have to not put the knot to cover the like that.
Right. So such dressing can also be used
Yeah.
like diaper tech.
Yeah. So, so I would
diapher
like to,
tap.
Anna, I would like to add something. So, this patient, I think, as Anna suggested, you can go for the diaper. No need to fix the gamgee pad. You can apply gamgee pad or that wound after cleaning or after applying any ointment. So then you can apply on gamgee pad. You can put a gamgee pad or that area, and then you can cover the that area with a diaper or something like that. No need to apply plaster. And the another option is so we need to cover the area, or if they are not able to cover that area, like if you want to really expose that area, then you can suggest the mosquito nets. So okay, so mosquito nets. The thing is, if there is a infected wound there, the house flies are attracted. Okay, if the house flies are the touch the wound, it may lay eggs. It will come out with maggots. So that is the only the big problem here. So we need to cover the wounds because of this. And if they have a exudate and these kind of infections and that kind of things there, you can clean the wound and put a gamgee pad on that area, and you can cover with the uh, protect that area with the diaper like that. no need to fix the bandage everywhere. So I think, Anna, do you agree with that?
Yes, that is very important. Protection from flies is another thing, because if the patient is in very such area, no, then and flies will come, whether you are, even though you try to keep the patient very clean and like that, but when patient has the wound, flies from anywhere they will come. So that is always needed.
Okay. Okay, that means I
Many
can just.
times, yeah, even if though your patient is having a wound at the her perineal region, but if the wound is at other region, but where the exudates are large, right? I mean, more secretions are coming. So at that place also you can cut the pieces of even sanitary pads, similar of same size of the wound, and then place it so it will absorb the exudates, right? And you can apply metrogel powder so that will not give smell and like that, and it will also help in healing. So with that, I think patients can be taken care of, right, sister?
Yes, yes, you are correct.
Ma'am,
Okay.
Yes. So yeah, do you have any questions?
hello.
Yes, yes, Mary ma'am.
Ma'am, chronic ulcer we are using PRF dressing, ma'am.
Which dressing?
Hello, ma'am.
Yeah, could you please repeat?
PRF dressing, plasma fiber dressing.
Could you please explain more?
Chronic ulcer we are using PRF dressing, ma'am.
What is PRS dressing?
Plasma fiber dressing.
Okay. What is the action of that? I don't have any
Non-healing ulcer,
experience on
ma'am.
that's why I'm asking. I think,
Diabetic ulcer,
yeah. Okay.
that is correct or not?
That we don't know. Anna, do you have any experience on that? I don't have any experience. Anybody else in this group?
No.
Any
Ma'am,
experience?
we are using chronic ulcers or diabetic ulcers. We are using plasma fiber dressing, ma'am. Plasma fiber dressing means if the same patient taken for 5 ml of blood,
Okay.
the using of in centrifuge for lab, ma'am. The blood will clot, then the blood will
Serum.
clot and serum separated in bundle they were using for dressing.
Okay. Thank you. Could you please share it in the groups so that everybody can understand more about that? I think this is a new learning for all.
We are using in leprosy patients.
Leprosy, ma'am.
Okay. Thank you.
Thank you. Thank you, ma'am.
Thank you for suggesting this thing. Any other questions? So I think we can move on to the case presentation. Renika ma'am. It's over to you.
Sister Haripriya, if you are trying to communicate,
Can you hear me, ma'am?
the audio.
Hello, can you hear me?
Yes, you are audible.
Yeah, I'm Maripriya. I'm a staff nurse working in Wellbound Women Care Center. Next slide, ma'am. Okay, a patient is 60 years old male. He is diagnosed with multiple ischemic stroke, diabetic hypertension, and stage 2 pressure ulcer due to heat stroke, burn in the right earlobe. In the right earlobe, pressure ulcer stage 2. It is dry and on healing process. And another is right buttock pressure ulcer in stage 2, and right thoraco.
Sister Haripriya, you got muted. We lost you.
Can you hear me, ma'am?
Yes, in middle you got muted for a second. You can continue.
Sir, right thoraco. Sorry.
Yes, you can continue.
Stage 1 with new small blisters, right legs calf blister. Sacral and romy prominence intact and excoriation perineal. Next, yes, presenting complaints with comorbidities presented with emergency department due to unconsciousness, hypotensive and low oxygen level. Next. Yes, a known case of recent stroke on March 6th and on aspirin. Yes, presenting to the emergency department in unconscious state, and he was in a patient was in his usual state of health until 3 a.m. After that, he slept until 3 p.m. and then he found unconscious by family members. Patient is fully independent after last stroke, except disorientation, and became on diaper for unknown cause. Next slide, ma'am. On examination, patient is unconscious. His CNS Glasgow Coma scale is 4 to 5, and right pupil size is 2 millimeter, prompt, reactive to light. Left pupil over 2 mm sluggish. All limbs have no movement except right lower limb with flexion to pain. CVS is sinus tachy to NSR, normotensive to hypotensive, afebrile, capillary refill less than 2 seconds with pneumatic compression on left leg only. Right posterior leg with blisters. He was intubated and his saturation level is 96 with large white secretion from ETT and oral. Is on NG tube, is on Foley's catheter. Output is 60 to 140 ml per hour. Skin right earlobe pressure ulcer stage 2, and right buttock pressure ulcer stage 2, and right thoracocentric pressure ulcer stage 1 with small new blisters. Right leg calf blister, sacral and romy prominence intact and excoriation perineal. Next slide. ES treated with ES. All routine investigations are done. His pH is 7.1, PCO2 is 39.2, PO2 is 166.7, HCO3 is 14.6, PT is 16, PTIN 31, and INR is 1.4, HP is 11.9, and WBC is 31, MCV is 92.5, platelet is 2,60,000. Sorry, 2,06,000. Potassium is 2.9, chloride is 127, sodium is 141. Next slide. And magnesium, creatinine, all the investigations done. And he has taken ECG and CT brain. The findings are supra and intraarterial acute ischemic insults with a new few small peritechnical hemorrhage likely related to showing emboli. He has taken EEG, MRI, lower limb ultrasound, and dressing and mobilization. Next slide, ma'am. Psychosocial aspect is patient is calm. He was married. He had one daughter and son. He is not working currently. His son is taking care of all his financial crisis. Next slide. Patient is taking tablet Senat 12 mg OD, tablet acetaminophen 500 mg SOS, capsule omeprazole 40 mg OD, tablet IMN HCl 100 mg OD, injection heparin 5000 units subcutaneous 12th hourly, tablet aspirin 100 mg OD, and syrup multivitamin 10 ml OD, tablet docusate sodium 100 mg 12th hourly, tablet amlodipine 5 mg OD, tablet tetracycline CA 40 mg OD, insulin gargling 30 units subcutaneous OD, tablet valsartan 80 mg OD, and is on IV fluids. Next slide. Main concerns are yes, pressure, sore, pain, nutrition, financial problems, and the family support. Next slide. Summary, a 68 years old male had multiple ischemic stroke. He was unconscious and on ventilator. His family looks anxious about his prognosis and financial problems. Due to unconsciousness, he developed pressure sores in multiple areas. He was a known diabetic, hypertension, and dyslipidemia. Next slide. Points to be discussed. As the patient is unconscious with stage 2 pressure ulcer, how to give palliative care, how to improve his health condition as he is on a ventilator, how to take care of his wounds as he is unconscious. Thank you.
Thank you, Haripriya, for the presentation. Anybody need any more clarification regarding this patient story? Please ask her. Otherwise, we can move on to the discussion points. I think the presentation is clear to everyone. We can move on to the discussion points. I would like to hear from you all. So we all nurses, we all know that how to take care of pressure ulcer. So her question, Haripriya asked questions is, ask the patient is unconscious with stage 2 pressure ulcer, how to give palliative care. Now we understand what is palliative care, what is the aim of palliative care, that all we know. So please suggest something. We all are expect your answers. We listen your answers first. Anna, over to you.
Yes, so what we will do, patient is on ventilator, so it is one hurdle, you can say, how to go about it. Many patients, when they are in ICU, they develop bed sores, right? Because we are after saving the life, but in that patient becomes uncomfortable. That these things are, I mean, though it should not occur, but many common things. And many times it also happens that when the patient is shifted to ward from ICU, they will notice the bed sore. That means there was no time of looking at other comfort of the patient in ICU. Is that so? As nurses, what we are supposed to do? Though when patient lands up in ICU, we have to save his life. That is one thing. But we should not forget his regular care, hygienic care when he is there. Right? So points from the group, what should be done? You can write in the chat box also.
So I have a small request. Kindly switch on your videos.
I think although patient is unconscious, but we still can continue to do the nursing care with whatever that we've been carrying out to uh, help for the wound, like the every 2 hourly turning, and also continue to do the dressing for him. And and normally for the palliative care patient, because we also didn't know how good is their blood circulation, ma. So it's for me it's like I would suggest, as long as the dressing can help to maintain the wound to be clean and to prevent the infection, that is the most important, lah. Because to get the wound healed, it has to depends on their body's condition. So yeah, I think to take care of the wounds is like continue to do the nursing care that we need to do, just like the normal patient. That's my suggestion.
Yes, right. So when though patient is on ventilator, but keeping in mind that the tubing doesn't come off, we have to change the position of the patient.
We can
Sometimes
apply
it,
some mattresses, no? Intermittent pressure mattresses.
yes,
Yeah.
such thing also can be done.
Yes, but sometimes we can't get no the limited stock and things, no.
Yes,
Sometimes in the ICU also we have some small quantity.
right.
And 2 hourly turning is the best. No?
Best solution,
And
right?
there is some exercises by using some physiotherapists or something.
Yes,
Mm. And other than that, we'll have to prevent the things, incontinence and the stools, and use
yes,
the proper management of eliminations.
yes. Patient is having urinary catheter, right? So
And
care of that also, so that patient doesn't get any urinary tract infection, and cleaning of the bed sores, right?
bed
So
sore.
you are right, regular cleaning, and it is only stage 2, so can be healed easily, right? And the diet of the patient must be having Ryle's tube, right? So what diet should go? And one thing I noticed that somewhere it is written that how patient turn to have uh, I mean on diapers. No, many times patients withdraw also, and because of that also he is bound to get be under diaper for long time. So whenever the patient is having diapers, we have uh, caretakers, many times they forget that diaper is tied, no, so no need for care, right? But that also needs regular changing. So carers should be advised for that when the patient is of course at home, right? So that should be the thing. And it also causes lot of perspiration. So with our Indian weather, it becomes more and more difficult to manage the patient in bed with diaper. So that is another thing. Then I did not see any pain medication. Analgesic is not there, whereas patient is getting some pain when the movement is done of the leg, right? So pain
Priya,
medication can be
Sri,
Yes, ma'am.
yeah.
there.
Yes, Priya, please go back to the main concern slide.
Yeah.
Yes. Haripriya, you had mentioned about pain. So where is pain and what is the score of the pain and what medication is for the particular problem?
I'm sorry, ma'am, it's not my original case. I'm working in a clinic only.
Okay.
I borrowed it from my friend, so I didn't really know about this case.
So, okay,
Sorry, ma'am.
yeah. So from this slide, we have understand that this patient is having pressure ulcer, pain, some nutritional problem, financial problems, and the patient need family support. So these are the main concerns. Uh, kindly go to the discussion points, please. So here, so I would say this is HAPO, hospital acquired pressure ulcer. So when the patient come to the hospital, there is no pressure ulcer. After that, he developed pressure ulcer within the ICU. So that is because of, I would say, the poor nursing care.
Poor nursing care, ma'am.
Yes. So the another thing is, whenever you have seen a patient, a bedbound patient, either semi-conscious or unconscious, or a bedbound patient, even paraplegic patient also, they are not able to move independently. Okay, they are able to move their upper limbs, but they are not able to move their lower limbs. They are also bedbound. So whenever you have seen these kind of patients, you have to keep it in mind first in what are the ways to prevent pressure ulcer. Okay, the thing is, the small tip is double SKIN. So the first S is, you have to think about the proper supporting surface. Okay, you have to think about air mattress, water mattress, pillows, that whatever need that patients, you have to think about for supporting surface. The first S is supporting surface. The second S is skin inspection. So whenever we need to change the position every 2 to 3 hours. Okay. So whenever we turn the patient from one position to another position, we have to check the pressure points, especially on the pressure points. If you have noticed any color change on that area, we have to prevent further pressure on that area. So that way we can able to prevent the damage of the skin. Okay. So the third one is K. K is keep moving. Okay. So keep moving means every 2 to 3 hours we have to check that area. We have to change the position. And the fourth one is incontinence control. Okay. So we all know that the three major causes of pressure ulcer is continuous pressure. The third one is friction. The second one is friction. The third one is moisture. So these are the three major causes of pressure ulcer. So here, incontinence management is also important. So this patient is having a Polish catheter. If they are willing to put a catheter, you can. Otherwise, you can advise them to use diaper. That also they have to change it frequently. And also, if they are not affordable, they can use their own sheets. But if the thing is, if the linen get wet, so they need to change the sheets as soon as early as possible. That is also important. The last point is N. N is nutrition. Nutrition and hydration is also very, very important. So we have to keep it in mind. Double SKIN always. Whenever you have seen this kind of patients, you have to think about these all things. Okay, and you have to empower the patient and educate the patient and the caregivers about the importance of preventing pressure ulcer. Okay, this patient has developed a stage 2 pressure ulcer. So that time we need to prevent further induration. So that is also important. Okay, this is second stage pressure ulcer. We can able to cure this stage 2 pressure ulcer, but at the same time we need to prevent further induration. So that way we can able to prevent further formation of pressure ulcer. Okay. So the third question, how to take care of his wounds as he is in unconscious. The same way we need to that take care of this patient. Okay. So stage 2, this is unconscious. For a normal patient also, stage 2 management is you have to clean with normal saline. So there is no ulcer, only peeling of skin there. So you can clean with normal saline and cover the area, and we can prevent further pressure on that area. So that way we can able to prevent that further induration. So Anna, do you want to add anything more?
Yes, right. And of course, the very difficult to score pain in unconscious patient, but that also need to be looked into. And the diet, of course, what diet he is getting, that thing. And patients' relatives are having anxiety, like that it is mentioned. So they also need to be involved in patient care, so that will help and in reducing their anxiety, right? And whatever you do, you have to keep them informing what is the condition of the patient, that you need to keep on informing him. That is essential. So uh, patient also has a high urine output, I think maybe because of IV or what. So patient's potassium has potassium level is also low, 2.9 it is written. So that also needs to be looked into. So I was going through the lab values and also I found these additional things. So, and son is taking care, so that is good. Since how long he is taking care, someone else can also be part of patient care or not. So such options can also be found out. And of course, when the patient deteriorates very much, we also need to advise, advocacy about DNR and all that is also important. We don't know the patient's condition, right? But when the patient's condition becomes very poor at that time, we may have to take other options. Right, sister?
Yes, yes. Yeah. So this patient, I think this patient need a basic nursing care because he is totally unconscious. The total care he need. So and the another thing is the patient is on nasogastric tube feeding. So the feeding is also you have to that do a proper way. Otherwise, these patients will develop aspiration pneumonia because of the technique. Because we need to elevate the head end of the bed before feeding, and also after feeding also you have to keep the same position at least 30 minutes. Otherwise the food material will regurgitate and directly goes to trachea, and the patient will develop aspiration pneumonia. Because when you introduce a nasogastric tube, our gastroesophageal sphincter is always open, no? So there is no sphincter is there, so there is a chance of aspiration. So that is very, very important. If the patient, maybe the caregiver request you to discharge the patients, you need to educate the caregivers about the total care, how to feed, how to take care of the catheter, how to prevent pressure. So these all things we should educate well and demonstrate well if they want to discharge. So that is also important. Okay, so day by day, the patient's condition you have to tell the caregivers. Okay, so whether the prognosis is good or bad, you have to give a proper explanation, and about patient condition, you have to tell the caregivers and make a rapport with them. Okay, and they understand their emotions also. They are going to sometimes they are going to miss their loved ones, so their feelings will be there. you have to listen their emotions also. Okay.
There is another point also was there regarding excoriation in his perineal region. So that needs to be addressed, whether patient is having any, though patient is I think receiving two types of uh, for constipation, two types of drugs patient is receiving, but patient has excoriation in his perineal region. So what is the reason that needs to be addressed?
Okay.
So,
Thank you.
yeah,
Anna, continue.
that's all, sister. Thank you so much.
Okay, thank you. So, thank you, Anna, for the wonderful presentation. Thank you, Haripriya, for bringing up this case presentation. I have a small request to all is, this is why we request you to bring a patient stories. We need to discuss. Okay. After the theory class, we need to discuss with the patient story. Before presenting, come to the presentation, you have to thorough understanding about patient story. Your friend or anybody, you can, that is okay, but you have to get a full details from your friend and present it. So that will be better for us to understand more, and others also will get more idea about it. Okay, thank you.
Thank you.
Thank you, Sister Anna, for joining us and walking us through that wonderful session. Hope everyone would have got better knowledge regarding the management of pressure source today. And before signing off, just a humble reminder that some of you are yet to send in the case presentations, which would affect your certification at the final stage. So please do make sure you are sharing your case presentations without delay, because the faculty panel won't be considering cases which are sent in very late. So with that note and a promise that we'll be meeting again with the second part of wound management in the next session. This is Sri Priya along with Sister Anna Rao Daniel and Sister Shiba and Mr. Anoop signing off from the Tips Eco Hub. Till the next session,
Thank you.
everyone take care, be happy. Bye-bye.